So when we're doing a thoracic ultrasound, finding a pleural effusion is really just step one. The real clinical challenge, and honestly where all the diagnostic power is in figuring out what kind of fluid we're looking at. Today, we're going to zero in on one specific sign that really helps us decode what's going on inside that effusion. Okay, so you've found the fluid. Great. But the real work is just beginning. The most important question isn't just, is there fluid here? No, it's what is the nature of this fluid? Is it simple or is it complex? Because that answer completely changes your differential diagnosis and can mean the difference between watching and waiting and intervening right now. So here's our game plan for this explainer. We'll start with that big clinical question. Then we'll define the plankton sign itself. After that, we'll get into why it shows up, what it means for you clinically, and we'll wrap it all up with the most important diagnostic takeaway. Right, so we're way past just detecting fluid. The real magic of thoracic ultrasound is in characterization. It's about finding those little clues inside the fluid that point us toward the real cause, whether that's something like heart failure, a nasty infection, or even a malignancy. This right here is the fundamental split. On one side, you've got your simple effusion. Sonographically, it's quiet. It's anechoic, totally black, which is what you typically see in a transudate. But on the other side, you've got the complex effusion. This one's busy. It is full of internal echoes, debris, and it's screaming exudate, pointing you towards something like an infection. Being able to tell these apart at the bedside is absolutely critical. To help us sort through these busy, complex effusions, we look for very specific signs. And honestly, one of the most descriptive and, elegant signs is what we call the plankton sign. The definition really says it all. I want you to picture looking at a drop of seawater under a microscope with all those tiny organisms just drifting around. That's exactly what this looks like on ultrasound. You see these fine, bright, echogenic particles just swirling and floating inside the pleural fluid. And they move with the patient's breathing or even when you move the probe. It's a truly dynamic finding. So what is this plankton really? Well, it's not just one thing. It's a whole collection of suspended stuff. Basically, the microscopic fallout from whatever disease process is going on. We're talking cellular debris, strands of fibrin, protein, even components of blood. Every one of those little floating particles is a clue that tells you this fluid is anything but simple. Seeing the sign is one thing, but understanding why you're seeing it, that's what connects the image on the screen to the actual disease. The pathophysiology here is a direct window into the inflammation happening in that pleural space. This lays out the chain of events perfectly. It all kicks off with some kind of insult, an infection, some inflammation, maybe bleeding. That process just dumps a ton of cells, protein, and other junk into the pleural fluid, making it way more complex. All that material gets suspended, and when the patient breathes, it creates that classic dynamic, swirling picture we call the plankton sign. Okay, now for the most important part. How do we actually use this at the bedside to make better decisions for our patients? Let's walk through 4 key ways this sign is incredibly useful. First and foremost, if you see the plankton sign, your brain should immediately think complex exudative effusion. It lets you push those transudative causes, like simple heart failure, way down on your list of possibilities and start focusing on more inflammatory or infectious problems. Now, in a patient who has signs of infection, say a fever and pneumonia, the plankton sign can be a really early clue for an empyema. Those swirling echoes, that's the pus and debris starting to build up. When you see this along with other things like septations or thickened pleura, your suspicion for empyema should go way, way up. And that might just speed up the decision to get that fluid out. But remember, context is everything. In a trauma patient, or maybe someone who just had a central line put in, that same plankton sign suddenly means something very different. In that setting, the swirling material is much more likely to be blood, suggesting a hemothorax that might need urgent attention. And finally, this is just a super practical guide for any procedure you're thinking about. Seeing this sign tells you that the fluid is probably going to be thick, maybe even viscous. So that helps you pick the right spot for a thoracentesis. And, really importantly, it might make you reach for a larger needle or catheter to make sure you can actually drain that thick, gunky fluid. All right, let's tie this all together. We've defined the sign, we know what causes it, and we've seen how to use it. So what's the big final takeaway message here? This quote really just says it all, doesn't it? The plankton sign isn't pathognomonic for any one thing. You can't just see it and say, oh, that's an empyema, without any other information. It is a powerful clue. It's a piece of evidence that helps you narrow down the possibilities and really build your clinical case. So here's the bottom line. The plankton sign is a call to action. It's telling you, hey, this is a complex effusion. You need to dig deeper. You have to take this finding and put it together with the patient's story, their exam, and all the other data to get to the right diagnosis. And that brings us to a final thought for you to take with you. The next time you put that ultrasound probe on a chest and you see fluid, don't just stop there. Look closely. Look for those swirling, drifting echoes. How is recognizing the plankton sign going to change the questions you ask and the decisions you make?